Welcome back to the AUA Inside Tract podcast. My name is Steve Hudak, chair of the AUA Young Urologists Committee. In the past 3 episodes, we've heard from Doctors Nathan Grunewald, Julie Riley, and Damara Kaplan with regards to their unique perspective about important things regarding to the top 10 things I wish I knew before I started practicing. And in today's episode, we feature the Q&A discussion from this session at the Young Urologists Forum at AUA 2019 in Chicago.
So this is now the interactive parts. So please, we need your questions, and please come up and use the podium. There are mics on both sides of the aisle. Go ahead.
Hi, Shravan Piniganti from New Jersey. Thank you so much for talking to us. This is definitely something we don't get exposed to in our training. My question for you is when it comes to use of third-party recruiters. I was once told by someone, if you use a third-party recruiter, your contract dollars is a little bit less than it would have been if you negotiate with the hospital by yourself. Just wondering if you could comment on that, if that's true or not.
They definitely are paid a fee to find you. And so if a hospital has a budget related to how they're going to assign you the position, it could be reflected in what you get in your final contract. I think I would still just stick to my guns. There's plenty of data out there to show what it should cost, what a urologist should be paid, especially in your geographic location. So there's no reason if the hospital needs to use a recruiter to find someone that you still can't get that. Just stick to it. You should get it in the end.
All right. Well, first off, 2 of my South Central colleagues are up there, and I thank you for the recognition today. One thing that no one mentioned that I find is an issue, and I'd love to hear your thoughts on it, is transparency. So I started in private practice for a year and went into academic medicine the following year, where I've been for a while now. And in that first year, basically in the first 2 weeks of my practice, the practice manager came along, flopped a binder on my desk, and in it was every single CPT that was an E&M code that was billed by every single one of my partners, broken down in great detail. So I knew exactly what every partner in my practice I had joined was going to make. And on the other side of the fence, in academics, there's no transparency whatsoever. I have no idea what the other guys in the practice are doing or where their bread is buttered or anything. And it leads sometimes to a little bit of friction when I know that I've seen 20 patients in half a day and they've seen 5, yet they're driving the same car that I am. So I'd love to hear your thoughts about that and any advice you might have for any of us out here experiencing that.
Well, at least when I was in private practice, I knew exactly what everybody else was making. I mean, that's when you're talking about the monthly financials. I saw what my partners were bringing in. The thing with us is that we were setting our own salary, but at least you kind of had an idea. So there was a lot of transparency there. Now that I'm working for this hospital system and I've got 3 other partners, I actually don't have any idea what they're making because it's all different. So I agree that transparency in this larger organization is not there. In the smaller organization, we knew everything.
Yeah, I'm going to say from the academic world, I 100% agree with you that there's not a whole lot of transparency in the academic world. You can get those base salaries, you can get the very superficial things, but you cannot get, really how hard they're working, how much, they're really generating some of those incentives, all of those other things. And then you have some people who you're like, why in the world do they have all this operating room time? I don't get it. You can struggle with that a lot. The reality is be a good doctor and stuff is going to fall into place. Get engaged in there and really understand the hospital, how it's working. I know serving on a lot of committees in my hospital, I understand a lot of what's going on and I understand some of the politics behind it and sometimes why certain groups of people are getting more block time or more clinic space or seems to be getting more money because there's a push within the hospital to make sure that we keep certain services going and things like that I wouldn't have otherwise understood if I wasn't involved. So I think it's important to understand those politics.
And pay is super complicated, all right? It is not just the number. While the number is what we oftentimes focus on, there's much that goes into that. However, I will say from a transparency standpoint, I think you can expect to find more transparency going forward down the line. And much of that is going to be driven by the gender pay disparity. Those doors are going to start opening up so that you really can drill down into what the gender payments are. And I think that's a natural course that's likely going to happen over the next 5 to 10 years, for sure. I would anticipate that.
This is a great discussion. I appreciate these great presentations, great insights. Ian Thompson, San Antonio, and have gone through a lot of the stuff, having been in academics before, worked at the VA, been still part-time hospital employed, and started a solo practice. So I've lived in a lot of these things. But the transparency, at least in Texas, to Jonathan's point, we actually have transparency in the Texas Tribune. Well, you can look up any state employee's salary. So at least you have that. It can, unfortunately, sometimes you don't want to look because then you'll become more frustrated. But to the point about the question about the third-party recruiters, and I started something to help with this, is that it is true. It costs, you add $25,000 to $40,000 in your recruitment costs by going through a third-party recruiter. So for those that are looking for jobs and so forth, be very, very careful of who you actually send your CV to. Guard that, because what will happen is if you're talking to, you've got this postcard that says, $700, we all get these in our mailbox, $700,000, great place, like, why don't they tell me where it is? Then you call and they say, send us your CV. Let me see if you fit, and then we'll let you know. The reality is a lot of times they're just fishing for your CV, because they will maybe go and present you to other places that you're not even interested in. And once that hospital or that group sees your CV, then you just became $40,000 more expensive, perhaps, compared to somebody else. And so you may go down the stack, because once they present you, they're obligated, how these things work, to then pay that to even for you to come and sign a contract with them. So it's definitely better to invest the time to reach out to the practices, cold calling. Actually, reps are actually a good place. If contact the reps in a region, if you're interested in a specific region, because they're in and out of every office weekly, if not, or monthly, and so they know what's really going on. And then spend the time to find the in-house recruiters or the actual practices. So.
Right. Super important to know that when you send your CV to a recruiter, that is proof that they recruited you. So if they represent that hospital in a recruitment process and you end up signing directly with the hospital and you really just were finding out from the recruiter something, that recruiter then can go to the hospital and say, no, I was involved in their recruitment. I deserve payment. That is the key. It's that CV that you sent that is proof that they recruited you.
So that's why I started something to help try to level the playing field for people that are looking for jobs, and a website. But I don't know. And so that could be better signing bonus. Put that towards your school repayment debt, something, because you're worth that. You're worth every penny. Sure. So just remember that.
Questions for Dr. Kaplan. You mentioned making sure the numbers and review the monthly numbers from your practice. What were the things that struck you or you were most surprising when you got into practice, when you started looking at those numbers in more in depth?
So, as I said, initially solo private practice, that was great. Lean and mean, you could control everything. As we got into the larger practice setting, really it was the overhead that was sort of appalling. How much things cost, how much your employees cost, why that person over there works for us and I don't know what they do. Trying to figure out how to control the overhead is what's going to make or ultimately break you. Like our practice was ultimately broken by the medical climate in New Mexico and the overhead. And so I think that that's what you really have to sort of drill down on. Drug costs, employee costs, where waste is. Trying to go to a meeting. Like if you leave your practice for a week, you've just written off $25,000. And actually sort of figuring out how much things cost you was shocking.
Thank you.
Hi, I was wondering if you could comment on ways to make your clinic more efficient in those early days when you're just kind of starting to figure out your flow.
I think the big thing is control your schedule. Make sure that you know what's going into your clinic and have a lot of say in that. Look at how your clinic flows. So understand your template schedules, understand a new patient, an established patient, procedure things that are going to slow you down, like procedures. Make sure that you allot enough time to them. Go down and talk to your clinic staff a lot about how things happen, how they work, what do they need. buy them lunch if you have to, several times over. Make friends with them and really understand what's going on with that. And those are things that can really help. And then also, understand your electronic health records. So understand, what templates do you have? Can you help to create some templates? What can you do up front to do that? Because when you first start in practice, you're going to be a lot slower at that point, but you're like churning to do more and more stuff. That's the moment. Capture it. Do a bunch of that stuff up front, because it's going to save you about a year down the line whenever you get super, super busy. So.
And watching out for difficult patient types. I mean, if you know that there's going to be somebody there that's going to suck 45 minutes out of their 15-minute visit, figure out, is there any way, you've got to see them, but can you jiggle it around so that maybe you could put some shorter people in that? Because there's nothing worse than running behind, going in and apologizing for being an hour late. So look at the type of patients that you're seeing. One of the things that I actually found to be the most difficult was trying to figure out how to take care of people who weren't actually sick. I mean, we all know how to take care of cancer. We know how to take care of stones. We can do trauma. But you get the person that comes in and says, it burns when I pee, and that's 45 minutes. Like, how do you actually come up with ways to take care of those particular patients? Sort of figure those things out and stick with them.
Yeah, there's work to be done from a clinic visit, either pre or post. You are going to have to do work. I have a philosophy in my clinic that the trains run on time. My time is just as important as the patient's. They get really upset, and we as in medicine, we get skewered for this all the time about waiting in a doctor's office for an hour and a half. So the goal is, if your appointment is 1 o'clock, within 7 minutes of your scheduled appointment time, I'm in the room. Because that means they got to get their stuff done, anything they need, but it also means we prep the clinic. So usually the day before, up to a week before of my clinic schedule, I have reviewed the charts. I have determined if that person's going to need a Uroflow, PVR. I want a culture from them. Maybe they need some imaging based on what they're coming in with. And I can pick up those people who are going to be a longer visit than what they're scheduled to do. And we can figure out how we can, if we need to adjust the schedule. By doing that front work, those people show up. I've already got the Uroflow if I need it. I have all of that information. If we needed labs ahead of time, it's done, right? We may even call them and tell them to come in the day before, so it's done and it's back. Because all of that work ends up being loaded on the back end then. My notes are templated out. I basically really know for the most part what the patient's probably going to need and what their diagnosis is when I walk in that room. They love it when they can tell you've read their chart. And they don't have to explain for the 15th time why they have dysuria over and over. And so it's super helpful. So I just do the work on the front end, and it pays dividends over and over on the back end. And you know what? Urology patients generate a lot of phone calls, right? When they feel satisfied and they have good understanding of what the plan is, because you've afforded the time to do that, those calls go way down. And that decreases the number of clinical staff you need to help you as well.
Great, thank you.
Hi, Kurt Namura from Brooklyn, senior resident. I just wanted to know if you guys could comment on the impact of fellowship training, today in 2019 in regards to, securing that dream job or negotiating that contract. What are you seeing in terms of the trends of more of us are opting for fellowship training, and how does that impact finding your dream job?
I think it depends on the market in which you want to work. So obviously New Mexico fellowship training is great, but we're so desperate for urologists that if you're well trained and can do things and aren't dangerous, you can kind of do whatever you want to. A lot of the residents that we have coming through UNM who want to go to bigger markets really feel the push for fellowship training so that they can get that job. So I think it depends on, number one, where you want to work, and number two, what you want to do.
Go ahead, Kyle.
No, please. Kyle Richards, University of Wisconsin. I just want to congratulate you all for your talks, just outstanding. My question is for probably Dr. Riley. I remember one of the things I struggled with when I was starting my academic job, going through the initial contract negotiation phase of things, was sort of trying to figure out what to ask for, right? You sort of said, well, you should ask for things, because it's always better to ask for it before you're there, because once you're there, it's almost too late, or it's much more difficult to get it. So how did you sort of grapple with what exactly to ask for? What are you asking for?
Yeah, I also struggled with this. So, because it was really hard. Everyone said, oh, you got to ask, you got to negotiate, you got to do this, you got to do that. But no one ever said, what do you ask for? What do you negotiate for? And again, coming into academics, they were like, here's your half-page contract, sign that. And there really wasn't a whole lot of wiggle room in what that was. I trained in, somewhat of a resource-poor environment, and then now work in a, for sure, resource-poor environment. And so a lot of the things I was asking for when I first started was, I got to make sure I have all of my scopes. I mean, that was a big thing. I really spelled out all of the, endoscopy or the endourology things that I needed. I made sure that I had protected time to go to meetings like this, and made sure that those things would actually work out to develop my career. I made sure that I had administrative time so that I could actually get research in and do that. And I also made sure that I talked to them about what was my niche in there, and made sure that those things were really set. How much general urology was I really going to be doing? How much oncology, different things like that. I didn't really have the ability to negotiate operating room time, though I certainly asked about that. That just really wasn't feasible. I kind of lucked out that I sort of fell into some open block time. But I think the biggest thing is you got to talk to your mentors whenever you're leaving, get their preference cards, make sure that where you're going has all of those things. When you're talking about clinic, make sure that you have, dedicated staff to urology. Find out, what do they actually know about urology? I mean, one of the things about preparing for clinic is I have a staff person who goes through the whole list and makes sure that all the labs are done, make sure that they're bringing in all that equipment. And so, making sure that those things are in place. And I think talking to, your faculty members that you trained with the people who are really efficient, like, which ones are better than others, right? So talk to them and say, okay, what do you actually need to get this job done? Because there's a lot of things behind the scenes that I think as residents, as fellows, even first starting out, that we don't really appreciate is going on. So ask those mentors, because we don't have all the answers. I certainly don't have all the answers, but those were a lot of the places I started with.
And then I have another question for Nathan. Going from, and this might sound like a stupid question, but are you ever lonely? I know you have a wife and beautiful children, but going from residency, med school residency, you're around a big urology department, and now you're off in Sauk by yourself. You're the only urologist in town. Obviously, you've got people in clinic, but how do you deal with, I think the question really is, how do you deal with that? I mean, obviously you and I talk a lot, but how do you deal with that aspect of your job?
Yeah, do I feel lonely? I don't. I guess I've maybe sometimes I cry myself to sleep. I don't know. That's something to be thoughtful of, So I've taken strides. I'm only 20 miles away from you, Kyle. It's not like I'm in the middle of nowhere. But the idea there that I don't have backup. I'm it. Okay, I can remember that first time I went into the OR, and I picked something easy. So I picked ureteroscopy, something I'm good at. But I can remember being in that room going, my God, if something happens, it's me. I am the one who has to solve this. And that was a reality check that you all will experience, even if you're part of a group. Ultimately, you will be the de facto leader, and everybody's going to look to you to solve whatever problem is happening at that point in time. And just know that I had somebody once tell me that it's you don't want to lack confidence as a surgeon. Now, you got to be smart about things, but you have to be confident. And we understand that surgeons sometimes have personalities that are very confident. But that is a trait that as a patient, as in a colleague, you want. And so I've done other things. Social media helps me out quite a bit. I reach out to people who have questions for prior residents. I don't want to lean on the same person each time I have some unusual sort of situation. But there's a lot of resources out there. As burnout becomes a bigger issue and the moral injury associated with that, and you will all, as the cliff happens here of urologists, you're going to feel more and more immense pressure to work harder and harder. that is going to be a huge component, is the control. And so we are absolutely going to need to lean on each other and know that we're not alone in this fight to take care of patients in the appropriate way. And so just pick up the phone, call somebody.
Because you can be lonely in a big group too, and that's the plug for getting involved with organizations, your regional urology. If things suck in New Mexico, call somebody in Texas. Is it better there? Is it worse there? You've got other people to talk to, and that's the whole networking thing, realizing that you're not alone and that there's a huge network of people out there who you can call, who you can talk to.
And I would echo that sitting in academic medicine, right? Like, I'm the only endourologist in the state. There are plenty of times that I'm sitting there saying, what? I'm doing what with really no backup. But, there is a huge network that's out there. And I don't think just because you're sitting in a big group that you're protected from that sensation. So make sure, have colleagues outside of urology because they can actually train you a lot too. Yeah.
Mike Ayler, Twin Cities. That's Minneapolis and St. Paul, by the way. Come visit. It's beautiful. So we're a big logbook group. And I'll make an observation, but for a question, and that is, what you guys haven't talked about and what has impacted me most in the last 4 or 5 years is the job and the practice you join is in a community, which is hospitals, and hospitals are merging, and a small group may come and go, they may grow, they may get absorbed. And the Minneapolis-St. Paul market is not the market that I interviewed in 5 or 6 years ago. And in fact, our group's yearly strategy, our big priorities are totally different every year because of the external environment. And just for urology, and not even DC, but like all politics is local, right? So my question is, what have you guys seen and how have you guys had to adapt with, and I'm not sure how the Albuquerque market changes, but we're a big market, and that's going to be really tough for people looking at a job because you don't really know, even between the time you sign, the time you come, and 3 years later, who are your, I don't say competitors, but what's the environment going to be? So how do you guys try to read the tea leaves around you to know what the next year's environment's going to be, whether it's different call or your hospital buys another hospital or a big group breaks up or gets bought? So do you guys have any advice for people looking at jobs? Because that's the one thing you haven't talked about that's like, it's an unknown, but it's going to impact you almost more than Washington, D.C. politics will. It's kind of what happens around your hospital and in your community and metro area.
I can only control for so much. And I appreciate the sentiment and the thought there, but there's only so much I can really plan for and control. Just like when you're on call, you can be having a great day and it can be one page and your whole life changes. But at the same time, you are kind of thinking in some of that, right? This is why I'm like, be nice, because the person that might be buying out your group that you just said, I don't want to join your group, can come back. Burning bridges is, in my mind, never a good idea. But you may be their colleague in the future. So I think the best thing you can do is just play nice in the sandbox as best you can, realizing that there are competitive issues at play. But you can do your best, but you can't control everything as much as we would like to.
I think being flexible, never say never. I was going to be independent practice till I died, but that didn't work out. And so now I have a different kind of job. And I think don't get too set in what's just going to make you happy. And the other thing is remember that there are so few urologists that we really are sort of like the unicorn. The projected need is 16,000. How many there are going to be? Like 8? So just remember that you are valuable, you bring something to your community and play off of that.
Yeah.
I don't think we're shielded in this in academics at all. In fact, I would argue it's probably worse, right? Because at any moment, my chairman can leave, and now I have a new chairman. I can have different division chiefs. I can have different partners come in that maybe I don't really agree with. I can have a couple of my residents are in the back room, so I don't want to say anything too bad, but I could have residents that maybe I don't want to train. And I mean, there's a lot of different variables that go on in there that we have to deal with. And I think flexibility is incredibly important. I think sometimes you have to realize what you can't do. I mean, at some point you might have to say, I need to cut bait. This isn't right. My expectation of my job and the reality of my job are too far apart that I need to find something else. But it's important when you do that don't leave because you don't like the job. Leave because you have a better opportunity, right? And I think that will really help to kind of get rid of this notion of, well, the grass is greener over there. Let me just go over there, and then realize that they have a similar amount of problems, just a different set of problems, right? So I think it is really important to be adaptable. I think being involved in a lot of things really helps, because if, for instance, your group or your department, your division decides to move a different direction, if you have your fingers kind of in some different areas, you can mold to that pretty easily and say, okay, now, I need to change a bit of my goals and how we're doing that. So don't be too rigid in things.
Rick Slater, Great Falls, Montana. You kind of actually just touched on the question I had. I'm in the second year into practice and kind of learning things, and overall I'm generally happy, but I think the question that, one of the topics that we didn't really discuss was job change. And like, when do you make that decision to start looking, and what does that look like when you're in practice? I mean, I'm not planning to do that, but it's, as I'm coming to the end of the contract, I'm also thinking, well, is the grass greener on the other side? It's probably just as hard to cut, but where do those factors come into play, and when you make that decision to actually start looking and keeping it confidential, because I'm sure you don't want your current employer to know you're looking for a job and those type of things?
I go back to my priority list. How far am I deviating from my priority list of things that I want, in life, and evaluate it that way. And at some point in time, if you're sliding so far away of what you really thought about you want in life, the hardest part is making that decision. And it's incredibly difficult, but if you're never willing to cut that cord, you can really be in a rough position. It's like going in and buying a car and not being willing to, I really want this one. Sure. And you don't know how to negotiate. You got to be able to walk away from the table, and with the list you're going from are kind of your priorities in life and working with your family. It's super hard, but also realize it's really hard to replace you, and so you really do have some pull. And the cost to replace a physician in this country, if somebody leaves, is anywhere between $300,000 and $1 million. That's what it costs in lost revenue, recruitment costs. It's super expensive. They do not want you to leave. But if you're not willing to say, I'm leaving, then you lose some of that side of the equation.
Yeah. I mean, I would also say, I think it's important to tell people what you need. Mm-hmm. You can't just wait until you're, at the edge and you're ready to explode, and then expect them to do a whole lot for you at that moment. I think if you're in a situation where you're like, listen, if I just had this, things would actually be a whole lot easier for me. Go and talk to somebody about it, because the reality is they do want to keep you. They do want to see you happy. But if you do it whenever you're pretty calm and you're not sort of at that breaking point, they're probably going to listen to you in a lot better way.
That sort of goes back to my get to know your medical staff affairs people, so that when you call at 3:30 in the morning because you're really angry about something, they'll listen to you because you've been reasonable for the most part. Bring up what you need, approach them when you're not angry. And I think that you're going to find that that's going to be more efficient. Let them know what the problems are. As long as you have a reasonable request, somebody will listen to you.
Sure. Thank you.
So we have about 5 minutes remaining in this forum. I can see that lots of interactive questions. I also want to remind that if there are any questions relating to urologists from government services, Dr. Hudak is happy to answer that. I know that the speakers touched about resilience and priorities, and burnout is a big issue. So I just wanted to hear your advice to young urologists in terms of work-life balance, and how important it is to maintain your well-being, and it's important that we address this, so that because it's quite an important issue, the burnout.
I guess I'll go first. So first off, I agree with Dr. Kaplan. There is no balance. You're going to get pulled in one direction and then another direction, and the only person who is looking out for you the absolute best is you. So don't expect somebody else to hand you this stuff. I don't believe that meditation and mindfulness is going to get us out of this situation, but I do believe that mindfulness and meditation and taking care of yourself is the one thing that you have control over. And it's what we're all seeking, right, is to have a little bit more control. So do take time for those things that are important. Schedule them on your calendar. I live by my calendar and what it says I'm supposed to do. For the most part, I do. I will say, and nobody needs to do this, but what has helped me the most with burnout was I trained for Ironman triathlons. And that has been tremendous because I just have hours where I just think and don't have to worry about work. And I have to go and make those training sessions in order to actually survive a lot of my physical endeavors. I don't have a family, so you could fill in your family for that sort of thing. But you got to make those priorities. And when you set that priority, live by it. And, there will always be work. There will always be patience. But the rest of your outside life, you don't let that go to your wayside. So.
It's kind of an evolution because in the beginning, I sort of think that family loved ones things suffer because you have to work to establish yourself. But I think at some point you have to realize okay, I've done enough. I am who I am, and then try and take a step back. And I think that's really hard because I find it very difficult to say no. Do you want to be a committee? Yeah, absolutely. Oh, no, I don't really want to do that. And so setting your boundaries, learning what you want to do, and then realizing spouse, friends, family have to be a priority, and also protecting you and your own sanity. I mean, I agree with Dr. Riley. I would love to be meditating and mindful all the time, but it just doesn't work. But you've got to realize that you have to care for you, and you are important, because if you are poorly nourished, you're not sleeping well, you're angry, you're going to do a bad job with your patients. And so, although sometimes it seems like a luxury, you have to carve out time for yourself for sleep, exercise, nutrition, spirituality, whatever, floats your boat.
Burnout has really evolved over the past 10 years in healthcare, and part of it has to do with burnout really in its etiology. And there's a good paper that just came out end of last month out of Massachusetts Medical Society that summarized this eloquently. It is a systems-based problem. It is not something you're doing. It is something the system is doing to you. Okay? That means and much of that has evolved from, believe it or not, it's actually not the EHR likely in and of itself that's the problem. The problem is the amount of documentation that you need to do that has nothing to do per se with your visit right there in the moment. And these are things that are coming down from government mandates saying, we need to check these boxes, we need to look through these things. Without necessarily a lot of evidence that proves doing those things actually improves outcomes. So all of this has been kind of pushed on us. It gets labeled as the EHR, and partly that's true, but really it's a systems-based problem. And until we start tackling it that way, and quite honestly, they take it a step further. Burnout is really moral injury. If you've not read that article that came out last year, I would encourage you to do it. You have taken an oath to care for patients, to serve in their best interests. These systems-based problems are really impacting your ability to carry out that oath. That then in turn hurts your moral compass and results in a moral injury. This is why it's so impactful to what we do. You went to medical school to make people better. Well, I know you couldn't really say that in the interview because that's not good enough, but really at the end of the day, that's what you're there. You're really trying to save people's lives. We all are. And when things get in the way of doing that, that's when it's harmful to you. So Code Lavender is never going to work. It is a systems-based issue. Getting involved. We've allowed, sadly, years ago, we allowed administrators, and I am one of them, to actually take control over a bunch of other segments of what we used to do in the clinic and in the environment. When we did that, we didn't realize the unintended consequences downstream that might be coming back full force to us. So now's our turn to turn that back around, and we need physicians at many tables within this country who are willing to pick up that burden and start influencing. This is a national level, local level, and everywhere you can possibly get to really just we have the best interests of the patients at heart. And this is why we need to do this. There's simply not enough of us to go around. We have to keep as many as we can.
So you guys have heard it. Get involved, take care of your spouse, and train as a triathlete. So I'd like to give a big round of applause to our speakers, Dr. Riley, Dr. Kaplan, and Dr. Grunewald. I would like to thank my co-chair, Dr. Hudak. Big thanks to Adrian Williams, who helped organize this forum. Thank you.
Thank you for listening to the AUA Inside Tract podcast, an official podcast of the American Urological Association. For more information, please visit auanet.org.